Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about dual special needs plans, heart health and obesity, and diabetes in children, all coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone. The last thing anyone needs who is very, very sick is a complicated process of getting help and getting the health care they need. My first guest is going to explain a system whereby they can get a lot of help. So good to see you. It's Dr. Barbara Nabrett-Stevens with UHC Community Health Plan of Tennessee, and you live and breathe this every day.
I do.
So tell us, what is dual special needs plan, the dual special needs plan?
Well, thank you, Amy. I'm so happy to be here.
Glad you're here.
The dual special needs plan, which is quite a mouthful, is a special Medicare Advantage plan for people who qualify for both Medicaid and Medicare. And if they do qualify for those two programs, they may qualify for the dual special needs program, which we call DSNP.
That makes it easier. Yeah, sure.
DSNP for short.
Okay, so let's give us a primer on Medicare, Medicaid. We just assume everybody knows what both are. Let's go over just briefly what they are.
Okay, fine. So Medicaid is a program that provides health benefits for people with low income. Medicare is a program that provides health benefits for people 65 years and older, or they can be younger than 65 if they have a disability that qualifies them for the program.
Then you've got Medicare Advantage. That's a supplemental program. Is that right or not really?
No, it is not supplemental.
Okay.
That's another type of Medicare program.
Gotcha.
Or plan. The Medicare Advantage plan is a product sponsored by a commercial health insurance company like United Healthcare that combines a person's Medicare benefits along with their Part D prescription coverage benefit into one, and it may offer additional benefits such as dental, hearing, or vision.
All right, so who would be eligible for the DSNP, if you will, then?
Okay, so the dual program, or the DSNP program, is a program for a person who has qualified for both Medicaid and Medicare, and who also has special medical needs and could take good advantage of help in navigating the healthcare system.
Maybe give us a profile of someone that would be one of your subscribers to this to the DSNP program. Sorry, who would be a patient that could really benefit from this? Who needs to know about it?
That's a really good question. So take, for example, a person who has disabilities and needs help with daily activities like bathing and dressing. Or it could be a person that has cognitive impairment or decreased ability to function mentally, or a mental condition, or somebody, and this is unfortunately a huge number of people that have a number of medical conditions and are seeing a number of doctors and really need help coordinating their care.
Coordinating, navigating, and probably a lot of these people are living with some type of caregiver. There's someone that is taking care of them, and they need to know about these programs too to help their loved one.
Oh yes, we live in a village. We need all the help we can get, and yes, one of the things we hope that this program will provide is information not only for the subscriber but for the family who may think that there may be something more that they can do and don't know where to turn to get that help. So this is a program that they certainly should consider.
Is this something rather new? Has this been around for a while?
It's been around for a while, actually, and there are, in 2017, there were 2 million people enrolled in the DSNP program, and this represents about 3% of all of the people in Medicare.
My goodness. Are you talking about 2 million in Tennessee or around the country?
Around the country.
Around the country. All right, so obviously there was a need for this, and this program was created to take care of this population. So how do you make it simple for these folks who really need this?
Well, the reason that I said earlier that they should think about this in navigating the healthcare system is because by combining the benefits of both Medicaid and Medicare, you can help coordinate things better. And then we really encourage anyone involved in the care of a DSNP member to work with everyone else so that there's coordination in the care and the member can have a simpler way of navigating the healthcare system and achieve a better quality of life.
That's what it's ultimately about.
Absolutely.
Because as you said, a lot of these people are pretty sick with numerous illnesses.
Numerous illnesses and needing additional help. I mean, they might not need someone, a skilled nurse, but they may just need a home health aide to come in and help them out in the home, fix meals, or they may need social services, they may need transportation. There are any number of things that you need to do that you don't miss until you don't have.
Sure.
In navigating the healthcare system.
Where do people apply? When can they apply? Are there certain times of the year? And where do they go to get signed up?
The good news is you can sign up for a DSNP plan anytime, and you can switch plans anytime. Unlike the other Medicare programs, you're not locked into the Medicare enrollment period in the fall.
Fantastic. Okay.
Now, where? They have tried to make it as easy as possible to get information about the program. You can go online to find a plan at medicare.gov to see if there's a DSNP program in your area. You can call an insurance counselor at the State Health Insurance Assistance Program to discuss the program.
Okay.
You can reach out to a licensed insurance agent, and they can either talk to you in person or over the phone to see if a DSNP program is a good fit for you.
Okay.
And United Healthcare has people available to talk to you from 8 a.m. to 8 p.m. 7 days a week.
And I know you've got a phone number, or it's up on the screen. I see that.
1-844-588-5864.
There you go. Several different ways of reaching out and connecting with people, as you just saw and as you explained. Thank you so much for really giving us a nice tutorial on this program that could help so many people. Thank you, Dr. Stevens.
Thank you.
Good to see you. And we'll be right back after this. Of course, February is Heart Month, and you may not realize this, but every 40 seconds, someone in this country dies from heart disease. The numbers are still staggering. There have been a lot of improvements with heart health over the years, but we want to really focus on what you can do to prevent heart disease. Dr. Brian Wilcox is here from St. Thomas. And nice to see you. Let's start out with the broad topic of heart disease. We know there are many conditions related to heart disease. Can you just sort of paint the picture for us of what heart disease entails?
Yeah, sure.
Briefly.
So the way I explain to my patients often is heart disease is blockages in arteries. So if my cupped hands represent your heart beating, those veins on my hands represent your coronaries on the surface of your heart. And when people say they've had a coronary or they've had heart disease, usually in this country it means they've had a blockage develop in one of those small arteries on the surface of their heart. There are other conditions like valve problems, but most of the time when we speak of heart disease in this country, we're talking about hardening of the arteries or coronary artery disease.
And would you say the majority of the time those blockages lead to an event, a heart attack?
Well, many
Majority
times
of
they
times.
will. Sadly, in this country, people develop coronary disease at a young age. So we know in the coronaries of 20 and 30-year-olds, there's significant disease. So often by the time someone's in their 40s or 50s, those blockages become severe enough, they cause symptoms. And if untreated, those blockages almost always result in an event in their lifetime, most commonly chest pain.
Are most of those young people with a lot of the blockages in their arteries, is it genetic factors? Is it what they're eating, their lifestyle?
I think you just finished my talk beautifully because it's all of those. The truth is we can't change who our parents are. So what we're given genetically, we can't do a lot about, but everything else we can control in our environment. What we eat, how we exercise, what our other risk factor behaviors are like diabetes or smoking, all those determinants of heart disease we can manage very well.
Exercise, I see on our list, of course, that we're up on the screen right now, risk factors for heart disease, of course, diabetes, smoking, obesity, poor diet, lack of exercise.
Sure.
Exercise can actually increase the good cholesterol. That's good news, right?
Absolutely. So to your earlier point, there are a lot of things we can do to reduce our hardening of the arteries or heart disease. You can exercise. As you exercise, that cholesterol will actually drop, and the good and bad cholesterol ratios will improve. It'll decrease the percentage or the rate with which you develop percentage blockages in your heart, and your general fitness, your heart health improves with regular exercise. There's so many things we can do to reduce our risk of heart disease. So that regular exercise program, when combined with the right diet, that activity level, the right medications, the right other behaviors, no smoking is essential. All those things add up to reducing your risk of heart disease or controlling the rate with which it progresses.
How about reducing stress? That's one of those more abstract things, hard to quantify.
It is.
But it is critical, isn't it, in managing?
It is important. I would say it's probably overstated by a lot of patients. Everybody believes their life is stressful, and it is. But the stress that results in heart disease is a little different than just day-to-day stress. It's the stress like somebody stuck you with a needle. That's the stress that can cause really accelerated heart rate and blood pressure, which over a sustained period of time results in heart disease. But stressful lifestyles, to your point, over time will result in an increased risk of heart disease for sure.
Speaking of blood pressure, there were new guidelines, I understand, that were released last fall. Educate us on those.
Well, the American Heart Association guidelines for blood pressure we need to pay attention to have changed. So 120 over 80 are the new numbers. So if the upper number is higher than 120, then we need to start to pay attention. And if it's over 130, we need to treat that number. If the lower number or diastolic number is 80 or lower, we're okay. But if it's over 80, then it needs to be treated. So again, if your blood pressure is in that range or higher, then you need to see your healthcare provider.
What are the signs and symptoms of a heart attack? Is it, the crushing chest pain? It seems like usually with men you hear about chest pain or feeling upset stomach. That feeling with women, it seems that the symptoms are different. Let's go over those symptoms.
Sure. So for men, it's a more classic symptoms that we think about, and unfortunately that's kind of minimized the attention we pay to women sometimes who have symptoms. For men, that classic heaviness, that elephant standing on your chest with radiation pain to your neck or your arm is often seen. Sometimes shortness of breath or sweating when that happens. With women, the signs are a little more subtle sometimes. Fatigue is actually a really common symptom that women with heart disease describe. Sometimes just nausea or lack of energy or exertion. Sometimes sweating can be an indication of heart disease. So for women, paying particular attention to when they don't feel well and they have the appropriate risk factors can uncover heart disease.
Are there some tests that we ought to consider having or asking our physicians about getting, screenings for heart disease that will really give us a window besides an EKG? Are there some other scans or things that you would recommend?
Honestly, we start with just a good history and physical. So talking to somebody and saying, what's your family history? Who in your family had heart disease and how did it, at what age, materialize? And then talking to somebody about symptoms they might have with exercise or without exercise, that's a great starting point. Then there's, to your point, the EKG can be done, but then there's some blood tests around cholesterol or lipid status, which can predict heart disease. Those are early starting tests, And then when your provider has an idea of concern, then they order more sophisticated and expensive but very helpful tests.
Is there a test that will tell you your calcium score that's important too? I might be going too far down the path, like once you've been diagnosed and then you want to explore further, but I keep hearing about the calcium scores.
Sure. The nice thing about calcium scoring is it's often done with a CT scanner and it's pretty easily obtained. But again, that information, when you have it, needs to be interpreted very wisely. And usually that's done with kind of your heart care professional, like a cardiologist.
Okay.
So as a screening tool, probably not the first choice, but it's one of the tools that any good provider has in their toolbox that they can think about when they talk to patients.
One last quick question. Where can I find out, where can our audience find out more information? What's a good resource?
So two places I go to regularly and refer patients, the American Heart Association website and then the St. Thomas Health website has connections and links to all kinds of helpful things like Chest Pain Network, risk factors, and where you can go for treatment.
Great. Okay. Thank you so much. Happy Heart Health Month.
Oh, we hope so. Thank you.
Thanks, Dr. Wilcox.
You bet.
We'll be right back after this. Since the 1970s, the number of children who are obese has tripled. Just astounding. My next guest, Dr. Deanna Aftab-Guy with TriStar Pediatrics, who's an endocrinologist, is going to discuss this with us. Good to have you on.
Thanks for having me.
I know you were on one of the first Community Health Matters, so glad you came back.
Great.
All right, let's talk about this. It continues to be an epidemic in this country. Why is that? Why is it still such a problem with our kids?
Well, we're seeing more and more of it, but I think that folks are actually trying to do something about it now. Obesity is a problem, but rather a symptom of other things that might be going on, and I think that it's heavily, a strong influence is our genetics, and so if we have parents that are overweight from various inherited disorders as well as lifestyle choices, then their children are at higher risk. And so in our country we are seeing an increased risk, but there are several contributors.
Well, let's talk about some of those contributors again. So some of it is in the genes, unfortunately.
Sure.
But you can turn that around, but it's a lot of work, right?
Right,
I mean, it's
right.
changing your behavior.
Right. And I talk with my kids about this. We're trying to fight our genes, and you can't change that completely, but we can affect the things that influence how our body responds to our unfair genetics. And so we address the diet, number one. We address their body's activity level. What are they doing to move their body? And lifestyle in general, as well as addressing medications and evaluating them with a physical exam and laboratory assessment to see if there are other things that are contributing to their difficulty in maintaining a healthy weight.
So how can a parent tell when a child needs to see someone like you, a pediatric endocrinologist, that's a mouthful, and when there might be a hormone issue?
Well, number one important factor is to see your pediatrician. The child should have a primary care physician that they see regularly. We take our baby to the doctor every few months for vaccinations, but once a child reaches a certain age where the vaccinations are pretty much set and they start going to school, they tend to go once a year, maybe every few years, and they lose touch with their pediatrician. And we're starting to see increased obesity in children at younger and younger ages. If they are weighed and measured at their pediatrician's office each time that they're visited, and they talk with their pediatrician about all aspects of their child's health, including their growth, height, and weight, the pediatricians are very keen on this, and they will determine if the child truly needs just some simple interventions or an evaluation, or to be referred to a center that has several folks involved in a team that addresses these issues.
How is treating a child for obesity or one of these related conditions related to the obesity, how is it different than treating an adult?
Well, it's a good question. We have a team that addresses the dietary needs. We have a medical nutrition therapist and we have a physician, but we also talk about activity level. I think when an adult goes to their physician, a lot of times they don't always have available a nutritionist or dietitian, and that tends to have to be referred to separately. Also, the adult providers don't always have as much time to be able to focus on those issues. I think when you get to a subspecialist and the appointment's centered around that weight management, we tend to really jump on it as a team. So we do a thorough history, and I set up a separate consultation with our nutritionist, and my patients spend up to an hour and a half, sometimes 2 hours with our nutritionist. And I always tell them, I don't care what medicines I give you or how much time I spend with you, the reason why that child achieves a healthy weight eventually is because of my nutritionists. They're amazing. I think that they meet the family right where they are. We're not going to put them on a kale diet, as I tell them. They're families that have limitations based on financial needs or dietary preferences or allergies or what the rest of the family is going to allow to be brought into the home. And our nutritionists are excellent at hearing what they're able to do and tweaking it so that it can be healthier and benefit that child's health.
That's a good chunk of time, too, to spend with a nutritionist.
Oh,
I mean, you can
yes.
pack a lot of information in that amount of time. That's wonderful. What are some of the health risks associated with childhood obesity?
Things that we know as adults at being overweight. Children are at risk of developing diabetes at younger and younger ages. Type 2 diabetes, we're seeing at younger ages. They can have heart disease, elevated cholesterol that can lead to further heart disease, and then later on in life, strokes, joint problems, just overall inactivity because their weight and not feeling well.
And that's heartbreaking when you realize that had something been done when they were younger, someone intervened, nutritionists and someone to coach them on better choices and things, or if there is a hormone-related problem, to get to that. Help us understand the difference, too, between type 1 and type 2 diabetes in kids, and what are some of the symptoms?
So diabetes is elevated blood sugar. Type 1 used to be called juvenile onset, and that is when our pancreas, the part of our body that makes insulin, that stores the sugar for us for a fuel, the pancreas stops making that insulin entirely. It's an autoimmune disease, meaning our body attacks that part of the pancreas and makes the insulin. And without insulin, the blood sugar rises and cannot get into the cells. It's typically inherited, although you can get type 1 diabetes without any family history of it. And it's treated with insulin. These are the children that we know of that have to check their blood sugar and take shots and be managed carefully. Type 2 diabetes we used to think of in our grandparents and adults, and they still make insulin, and it's not an autoimmune process, but rather the receptor for the insulin is resistant, and it can be exacerbated and worsened by rapid weight gain. So you tend to inherit a tendency to develop it. You have to be that person that tends to needs to eat better and be more active, and you make too much insulin but don't manage your sugar well with it.
Okay, thank you so much for your time, Dr. Guy.
Thanks.
Thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.